most Latin American countries are in the middle of what is called the middle income trap. This happens to countries that at the beginning of their life, they tend to grow very fast when they're poor, but then they get stagnant and they can't grow. There are three areas that actually promote that growth, that they can actually move out of there and become relatively wealthy and rich countries. The three areas are health, education, and then personal security. So healthcare is becoming an incredibly important issue for Latin America, because the only way to get out of that middle income trap is to understand how to provide better healthcare system to our citizens, to make it more inclusive, to make it less discriminatory, and more importantly, that they can actually provide it at a cost that is affordable for a country of the income level of Argentina, Chile, Venezuela, Colombia, Peru, etc. Technology can help a lot. Furthermore, I think that tackling the problem from very different areas will allow us to be able to do the changes that are required. So technology on the delivery will be important. Also technology, understanding about the management of hospitals will be important. Technology of how to provide healthcare to people that are excluded will be important. Also understanding how the data can help us predict who are going to get out of hospitals, who are more likely to be sick, how to change preventive care. So can it be done? Yes, but it's incredibly difficult and complex, and we need to understand and bring the knowledge that we have and the experience that we have to put it together with the realities that we have in a country like Chile to be able to develop the process and the system that will guarantee this for the generations to come. As it happens in developed nations, it happens here, is that there's a waiting time to get a surgery. The problem in an emerging market is that that waiting time is longer and the proportion of people that are excluded from the healthcare system is much, much bigger. So yes, the middle class wants good healthcare system. The low income classes actually want any healthcare system. So yes, they are demanding more and more about healthcare, and that demands are translated in a system that is collapsing, that is overcrowded, and we can just not provide it. We have millions of people waiting for surgery. I actually think that if we ask the Chilean doctors or the Chilean administrators what vision they want, so what type of healthcare system they would like to provide for the Chileans, I think they will all agree on a system that looks very efficient, very inclusive, and equalitarian, and is very efficient. So I think that they will all agree on the principles. The problem is that in order to get there, you're right, there are humans make institutions, and we are unwilling to change the institutions. So there will be resistance from the political side, there will be resistance from hospitals that have a powerful position, and therefore they can use that powerful position for their interest. The same happened with doctors. So yes, in this process of reform, I mean, reform is not a cold party. Reform is painful. And reform implies that some will have to work harder, and therefore they might lose some of the benefits that they have in the short run, and therefore they will try to oppose any transformation. But I think this is not only exclusively of Chile. Look at the United States. We do have the same problem. And it will be much better to blow it up and then restart from zero. But doing that is difficult. There's far too many interests and people that will benefit from the current system that will be unwilling to do that. The same happens in an emerging market. So I think that on the other hand, I think emerging markets are more willing to explore. This is our fourth conference in the region, and this has been a very successful partnership that we have had, MIT with Latin America. This is our biggest one. At some moment in time, we had almost 550 people in the room. I like to be able to bring MIT to Latin America. I think the only way to learn about Latin America is to bring MIT here. I think the only way for Latin America to learn MIT and know about MIT is also to get that contact, to bring them together. MIT's newest mission is we want to build a better world. And to do that, we know that MIT has to have stronger relationships internationally, and furthermore, that we have to get exposed internationally. We cannot continue to do our research sitting in our offices. We need to come down here. The problems that are here are different, they're important, and we can have an incredible impact in the life, in the standard of living of most of the Latin Americans. So hopefully this is a start of that collaboration, and hopefully we will continue to do this in the future.